An apparent life-threatening event is a sudden onset of apnea or color change or both in a newborn. An apparent life-threatening event is considered a symptom and not a definitive diagnosis for code assignment. ALTE is an acute episode of a newborn that is disturbing to the person who witnesses the event. As many as 50% of patients with ALTE conditions cannot be diagnosed with a definition of the disease. The CDI should query when the test results are reported as abnormal and treatment is provided. A query for ALTE as the principal diagnosis will change the initial DRG. For example, if the physician answers the query and further clarifies the ALTE is due to GERD, then GERD is the principal diagnosis and ALTE is left off of the coding sequence. If ALTE is not the principal diagnosis on admission, a query for ALTE could result in the capture of a CC-MCC or an increase in the SOI or ROM. Causes include, but are not limited to, GERD, gastric volvulus, intussusception, viral or bacterial respiratory infections, sepsis, anemia, dysphagia, sleep apnea, epilepsy, seizures, metabolic disorders, or neoplasms of the brain. Clinical indicators of ALTE. Apnea, which is a witness pause in breathing or shallow or breathing or gagging. Caretaker report, it appears the patient is choking. Color change, patient can turn blue, red, or pale. Gasping, baby appears unable to catch their breath. Feeding difficulties. Change in muscle tone, infant appears weak or tense. Common diagnostic tests for ALTE are an ammonia lab test. Abnormal ammonia levels could represent inborn errors of metabolism or liver. Chest X-ray. Abnormal findings could represent a pulmonary infection such as pneumonia. Complete blood count. Abnormal findings could represent an infection or anemia. Electrocardiography. Abnormal findings could represent an underlying arrhythmia. Blood cultures. Abnormal results could represent a localized infection. Radiology tests of the brain. Abnormal findings could represent trauma, neoplasm, or a congenital disorder. Intestinal tests. Abnormal findings could represent GERD, dysphagia, or gastric volvulus. Pertussis culture. Positive results support the diagnosis of pertussis. Nasal swab for RSV. Positive results could represent respiratory syncytial virus. Polysomnogram. Abnormal results could represent sleep apnea. Common therapeutic treatment for ALTE include feeding instructions, keeping the child upright during feeds, burp child regularly, thicken formula. Treatment for possible GERD, IV fluid bolus, treatment for possible dehydration and gastrointestinal issues or infections, IV or oral antibiotics. Treatment for gastrointestinal or respiratory infections such as pneumonia, upper respiratory infection, gastritis, sepsis would include cough suppressants. Treatment for possible pertussis or whooping cough. Neurology consult or outpatient follow-up. Treatment for possible seizure or epilepsy. Oncology consult or follow-up. Treatment for possible neoplasm. CPAP treatment. Treatment for possible sleep apnea. And the possible query options for documented ALTE. ALTE, most likely due to pertussis. ALTE, most likely due to viral influenza. See if the physician will clarify the virus if known. ALTE, most likely due to RSV pneumonia. ALTE, most likely due to dehydration. ALTE, most likely due to GERD. ALTE, most likely due to febrile seizures. ALTE, most likely due to epilepsy. ALTE, most likely due to neoplasm. ALTE, most likely due to sleep apnea. ALTE, most likely due to dysphagia. ALTE, most likely due to breath holding spells.